Rose, and I am the Interim Clinical Director at Alternative Options Counseling Center. I feel like most people are familiar with traditional outpatient therapy, where you would come in and see a therapist for about an hour once a week or as needed. And maybe people are also more familiar with residential level of care, where you go somewhere for 30 days, you have 24/7 supportive care to work through the issues you're really struggling with. But I feel a program like ours, an outpatient program, maybe people are not as familiar with. So I'd like to inform you a little bit about what that is and a little bit more about what we do here at Alternative Options. You might be wondering, why somebody might seek an outpatient program, such as our Intensive Outpatient program or Partial Hospitalization program. Here's some of the most common reasons why somebody might come get care with us. Maybe you've been seeing a weekly, once a week outpatient therapist, and that's just not enough support for you. Maybe you've recently done residential or even a psychiatric inpatient stay, and you need a step down, what we call a step down level of care, so you continue to get support, increased coping skills, so you can thrive and really work on your recovery, no matter what the recovery is from. Maybe you're struggling with substance abuse and it's become unmanageable and it's affecting multiple areas of your life, and you need to work on your sobriety and get support that way. Maybe your mental health issues have become so out of control that you're not getting sleep, you're not taking showers, you're not able to get up and go to work or go to school. You're really noticing your relationships being affected, and you need support in that way. So our intensive outpatient is pretty much the same services for adults and adolescents, but the services and the programming is completely separate. Each person is assigned an individual therapist that they would meet with weekly. They're assigned a case manager for weekly case management, and it's usually more than once a week. It's as much as you need it, just to check in and make sure how you're doing in program, making your appointments, etc. Groups are offered Monday through Friday at a variety of times and a variety of topics to meet everybody's time, schedule needs, and then just clinical, treatment needs with whatever you're here struggling with. Intensive outpatient is a minimum of 9 hours per week per most insurance standards and per our national CARF standards as well. So that usually equates to the client being here on site a minimum of 3 days per week, maximum of 5 days per week. You also have the dietitian on staff if needed, if you are struggling with any eating disorder issues or other nutritional needs that you need support with while you're here. And then we also have psychiatrists at each location. They will meet with you the first week you're in program, and then will determine how often they need to see you from there for medication management. We also have our partial hospitalization or a PHP level of care, and that is a more intensive level of care for somebody who is really struggling with maybe safety issues, persistent self-harm, thoughts of suicide or harming others, maybe somebody who has stepped down from a residential or psychiatric stay, or somebody who maybe was already in our intensive outpatient but is really struggling, and we're trying to prevent them from having to go to the hospital or going to residential, so we might bump them up to give them an extra level of support. PHP is Monday through Friday, traditionally 6 hours a day, so it's a little bit longer day, but these clients really need that extra support, that extra level of care to get their symptoms stable. It's usually a shorter level of care, usually 2 to 4 weeks is standard length of time that we would hope to be able to stabilize that person and then step them down to our intensive outpatient level of care, where they just need a little bit lower level of support and their safety issues are pretty stable at that point. PHP consists of all the same things that our intensive outpatient consists of, but some things are increased. So instead of a once a week therapy session, they would get a twice a week therapy session with their therapist. They would see the psychiatrist every week. If needed, if they're struggling with side effects and things like that, or any other safety concerns that we need to address immediately. And then they're getting just a little bit extra focus on maybe some daily living skills that they're really struggling with, some self-care, some coping skills to really help decrease these safety issues that they're struggling with, and try and instill a little bit more stability and well-being into them, so that they can really continue to work on the recovery, be able to stay at home. That's one of the important things, is they're at home in the least disruption to their life as possible, and also giving them the best and highest level of support that we can when they're at that level of care.